first robotic stereotactic radiosurgery program. From being the first center to launch the CyberKnife in India in 2008 to setting up of this academic program, we at Apollo Cancer Centers remain committed to healthcare excellence. This initiative will be established at ACC in both Chennai and Bangalore and will provide advanced radiosurgery educational training to radiation oncologists, physicists, radiation therapists and technologists, and will benefit aspiring CyberKnife clinicians of India and the ASEAN regions. I request our esteemed radiation oncologists, Dr. P. Mahadev, Dr. Ratna Devi, Dr. Sanjay Chandrasekhar and Dr. Shankar Vangipuram to please join us on stage and be seated. Also like to share that Mr. Dinesh Madhavan, President, Group Oncology and International, Apollo Hospitals, has joined us online and we are honored by his presence and vision for this excellent program. We begin this event with a special keynote address by Dr. Ratna Devi, Senior Consultant, Radiation Oncology.
Good afternoon to all. On behalf of Apollo, I extend a warm welcome to one and all. Apollo, under the leadership of our beloved chairman, has always been a pioneer in advancing the healthcare in our country with cutting-edge technologies, and one such cutting-edge technology is this CyberKnife S7 FIM. This is an advanced radiosurgery equipment. I would call it as a leap in oncology, especially in radiation oncology. It's a radiosurgery equipment, I said. What is radiosurgery? Is there a real surgery? No. Because we get an effect like surgery, this is called radiosurgery. It is a non-invasive treatment. Swedish neurosurgeon Lexell pioneered this radiosurgery in 1950. And the first equipment was called as Gamma Knife, and it was meant for intracranial lesions. And decades of development and research, today we have the CyberKnife S7 FIM, which is the most advanced form of radiosurgery. It collaborates imaging, robotics, as well as artificial intelligence, and this equipment can treat both intracranial and extracranial, benign, malignant, and even functional. And always it has been a difficult situation for the radiation oncologist to target the moving organs, the moving targets, especially when you have a tumor in the lung. With the respiration, the tumor also moves, and to target and hit with such precision without affecting the surrounding normal tissue but only affecting the target has always been a challenge. Let me explain this with an analogy from Mahabharata. During the Swayamvara of Draupadi, there was a golden fish which was attached to the ceiling and it was rotating. The challenge was to hit the eye of the fish by looking its reflection in the water with the arrow. So the great Arjuna was able to hit with such precision. Likewise, in CyberKnife, with the real-time imaging, this can be achieved, hitting only the target with sub-millimeter accuracy, not affecting the rest of the surrounding tissues. And Apollo, we were the first. We launched the first CyberKnife in 2009, and thousands of people benefited. Radiation oncology has always been a teamwork with radiation oncologists, medical physicists, and radiation technologists. And in 2023, we got this new CyberKnife S7, and our successful journey continues. Thank you.
Thank you, ma'am. Our next speaker is our Senior Consultant and Coordinator, Radiation Oncology, Dr. P. Mahadev. Dr. Mahadev shall address us on overview and benefits of CyberKnife.
Namaste and welcome to all of you. See, the CyberKnife is the world's only robotic machine which we use in radiation oncology. And anything to do with robotics is usually associated with a precision which cannot be achieved with other type of radiotherapy equipments. So there are linear accelerators, cobalt machines, and this is the latest in radiation oncology where you can deliver a very high dose of radiation with a precision which was unmatched till now. The main advantage of this machine when we compare it with conventional linear accelerators is that usually most of the cancers prior to the introduction of radiosurgery and stereotactic body radiotherapy was that a course of radiation will take around 6 weeks to 7 weeks for completing the radiation treatment. Now with the introduction of this technology, it is possible for many of the cancers, though selected. So whether you take an early prostate cancer or an early lung cancer or a liver cancer, these tumors which previously used to take 6 to 7 weeks of radiation, 5 days a week, so around 35 to 40 sittings, now can be done in either 3 sittings or 5 sittings at the most. So the effectiveness is more, the time is less, and the discomfort to the patient is less, and there is a huge savings for the patient also in terms of the number of days that they have to stay here and undergo the treatment. The other very important advantage of CyberKnife is that it is an alternative to surgery without compromising on the survival rates, right? So if you see, for example, a brain tumor which is, let us say, very close to some structure, if we do surgery that may affect the functioning of the particular patient. Now CyberKnife has the capability to hit the tumor with such a high dose that the surrounding normal structure gets a very little radiation so that the function is not lost. Okay? So the function is preserved and the organ is also preserved. So that is one of the most important advantages, is that it has come out as an alternative to surgery in cases where the surgery is going to result in some major disability. The other very big advantage is, as Dr. Ratna just mentioned, that anything which moves in the body, and there are a number of tumors in the body which moves. So prostate is there, liver is there, lung is there, spine is there. All these tumors previously, to cover these tumors accurately with radiation, we had to include a bit of normal tissue around the target that we need to treat. But the CyberKnife, because it can see the tumor continuously during the delivery of radiation treatment, we need not treat any normal tissue surrounding the tumor. So the accuracy of this machine is up to a millimeter, and therefore any moving structure, so liver, lung, it has practically revolutionized the treatment of these cancers by radiation, because previously these tumors were not available to treat with radiation because we cannot deliver such high doses of radiation. So these are some of the advantages of CyberKnife. It is a tumor, it is a unique technology whereby any tumor, whether it is cancerous or non-cancerous, can be targeted anywhere in the body and can be utilized in any patient age group. With this I come to an end. Thank you.
Thank you, sir, for your valuable thoughts. May I request Dr. Sanjay Chandrasekhar, Senior Consultant, Radiation Oncology, to address us on the topic Applications and Clinical Conditions for CyberKnife.
Good morning, everybody. We've had a wonderful journey as far as the usage of this extremely modern, high-precision technology system over the last almost about 16 years. We were using the earlier version, which was the G4, and now we moved on to the S7, which also happens to be the first installation in this part of the world. Now, just to add to something which Dr. Ratna and Dr. Mahadev had to say earlier, this is the only linear accelerator which is so compact in size, and it's mounted on a robo. And the robo, which actually carries this LINAC on its shoulder, is actually a very famous robo called the KUKA. Now, to elaborate on the KUKA robot, the KUKA is a robot which functions in most of the high-end automobile manufacturing industries all over the world, like Mercedes-Benz, Daimler, BMW, etc., because the level of precision which is required in painting, fixing windshields, etc., is of a totally different level. And that is a robot which is now controlling this compact linear accelerator. The clinical indications, I'm sorry if this slide is not clear, but there are a number of clinical indications both within the brain and the skull, as well as outside. So it was actually with the advent of the CyberKnife system that we as radiation oncologists could even start thinking about using high precision radiation for tumors and other conditions outside of the brain and the skull. So today we are armed with an equipment which aids us in treating tumors in the lung. We can treat tumors in the liver, we can treat tumors in the pancreas, kidney, in the prostate. And some of the main advantages which Mahadev and Ratna earlier spoke about was, of course, I've already explained the KUKA robo, and this is a system which is able to track and treat a tumor. And if you had to summarize in one word, I would say probably the only linear accelerator radiotherapy system which does near real-time tracking. So especially when you take tumors in the lung, in the liver, in the pancreas, in the prostate, which are constantly moving inside the body, this is a machine which tracks and treats a tumor. It never leaves the tumor out of its sight. And it can be used for both skull and as well as tumors outside the brain. Sub-millimeter accuracy, as Dr. Mahadev was mentioning. And in earlier days, whenever we performed radiosurgery, that's another misconception which the public has to remove from their minds, that there's no surgery involved in this treatment. It's just a terminology which is used. It's called radiosurgery. And earlier days, we had to fix a metal frame onto the patient's skull, which required anesthesia, which required admission into hospital. But today, this is a system which does not require a frame. Hence, patients don't have to be admitted in hospital, and there's no anesthesia required, and it's absolutely painless. And as Dr. Mahadev just mentioned, one of the fascinating aspects of this machine is the convenience which it has provided most of our patients. For example, this is a very common cancer which is treated all over the world, and a prostate cancer treatment could take anywhere between 6 to 8 weeks for completion, and it involves about 30 to 40 sessions that the patient has to report to hospital as an outpatient. Now, you have to just think about it for a second, because whether you live in a developed part of the world or you're living in a country like ours, it brings down healthcare costs considerably, because if you have to talk about traveling to hospital 5 days a week for 8 weeks, you can imagine the amount of money which a patient is spending on fuel and the amount of time he takes on the road. Versus the same treatment which can be done on the CyberKnife system, which completes the treatment in just 5 sessions. So we have a lot of patients, since this technology is not available so freely even today in our country. There are hardly about 10 or 11 CyberKnives operating today. We get a lot of patients from outside our city. And when you talk about asking a patient to stay in Chennai for 2 months to undergo this treatment, you have to add costs of accommodation as well, even if it is not in the hospital. And it brings down, even for outpatients who live in our city, it brings down fuel consumption. So this is a wonderful tool, and it's kind of revolutionized treatment care. Thank you.
Thank you, sir. The next talk is by Dr. Shankar Vangipuram, Senior Consultant Radiation Oncology, on the topic CyberKnife Academia, Purpose and Uniqueness about the program, Training and Expertise. Over to you.
Colleagues, friends, ladies and gentlemen, namaste. At the outset, let me just draw your attention to the fact that if any hospital needs to excel, there are 3 fundamental pillars. And these pillars include the experience of the clinicians, the expertise of the clinicians, and the technology on which these clinicians are working. We at Apollo have a wonderful team of clinicians with a cumulative experience of 9 decades, all of us put together. We did thousands of patients, probably lakhs of them if all of them are clubbed together. And the beautiful part of this entire flow is the technology which is brought to the table for the clinicians to work. Hats off to our leadership team who have left no stone unturned in getting the best and the finest of the technology for the clinicians to work and improve the clinical outcomes. And this technology, what we are speaking, and as alluded by my colleagues, is what is called as radiosurgery, CyberKnife radiosurgery. As Dr. Sanjay has already alluded to, the biggest difference between conventional treatment and radiosurgery is we are thinking like surgeons. We are thinking like surgeons. You know, surgeon, if they come, they want to operate a patient, they just go in, do the surgery and get out. Here, this technology has given us an opportunity to think like surgeons. And when we start thinking like surgeons, there are 2 things which are very important. One is the accuracy and precision. So this precision needs to be sub-millimeter, because any extra millimeter which comes, that burns the normal tissue and therefore increases the side effects and the risk which the clinicians take. So, summarizing whatever has been told by my earlier speakers, we are thinking like surgeons, number 1, and thinking like, what I would say, abbreviated format of cricket, which is T20. Instead of T20, it's T1 or T4 or T8. That's the simple way of putting the best use of this technology, what we are practicing over the last couple of decades. Now, this science, what we say, is called radiosurgery. You're thinking like surgeons, but there are different tools which are there. And CyberKnife is one of the best technology which I've been working. I've worked on all the tools which are available on the planet, and of course all our colleagues as well. Our intent has always been crystal clear. We need to propagate this particular science of radiosurgery with the tool which we are using to the vast number of clinicians to change the healthcare landscape across country and other geographic areas. With this particular motive, we have signed our joint collaboration effort with Accuray, who is the manufacturer of this particular technology, with very, very specific goals. And these goals are quite relevant in the Indian context, because we are speaking of very high-end technology, and therefore the clinicians need to gear up for the technology and get tuned to it. This is the point where the clinician experience and expertise really matters, because all of us have seen decades of these patients getting treatment, the side effects, the responses, the toxicities, and every patient we keep on learning and learning and learning. You know, there are ways we can improve the outcomes, and this medicine obviously is a very dynamic field, and we are in the process of improving everything, whatever we know. The second important thing, what I would like to draw your attention to, is this collaboration has a very didactic curriculum which encompasses theory as well as the practicalities and the nuances in the patient care with regards to patient selection, the execution of the treatment, and what should be the quality assurance which needs to be done from the physics perspective. So we have a wonderful physics team also with us. They are being extremely supportive to us in doing on complex treatments. So essentially this team, the physics, the technologists, the clinical team, everyone, we look into some measurable response, measurable outcomes as well. You know, one of the important thing is the responses which the patient get post-treatment, the survival, whatever we say, the progression-free or the overall survival. So essentially, this platform will give us opportunity to share our decades of experience with the colleagues and the trainees who come from across the globe, and specifically from our country, that actually will enable them to do a lot more justice to the patients whom they are seeing in their own center. Now, this time-bound program is essentially for 2.5 to 3 days. They have post-completion evaluation just to make sure they are having the standards which are designated from our collaboration efforts. And more importantly, we focus on the patient selection. That's the most important part when we are aiming to improve the clinical outcome. So not every cancer is suitable for radiosurgery. Likewise, radiosurgery is not the panacea for every cancer. So we need to choose our battles extremely carefully and wisely, and that is where we essentially put our efforts into practice. And I'm sure this would empower the oncologists and the clinicians to advance their knowledge, and that will simultaneously also eliminate the need to go abroad, cut down the cost. It's something like Make in India initiative from Apollo and Accuray. So we have over 20 odd clinicians who will be visiting us over a period of a year, whom we are very hopeful to train to the best of the standards. And I'm sure this initiative, joint collaboration, will really benefit a lot of clinicians and the patients in other areas. And I would like to thank our leadership team, specifically Dinesh, who has been spearheading this entire initiative, and also Sheila ma'am, our CEO, who is extremely cooperative when it comes to patient care. Thank you so very much for your patience.
Thank you, sir. Can we have some mics on stage? now like to open the forum for question and answers from the audience. Any questions from anyone?
What is the cost of the surgery one? And when you train clinicians, what will be the cost for the clinician to take do this? And the other hospital even buy this equipment that is installed.
So, when we are speaking about the cost, you need to. Shall I answer? So, when we are speaking about the cost of the technology, I'm sure that's something which Accuray will point out, but it's around $4 million US dollars. Four, am I right? It's more than that. I'm not really sure about that. But what I would like to tell you is, in India, we are doing treatments at a fraction of cost in as to what it is being charged elsewhere outside Europe and US. So if we speak in terms of the individual patient costing, it will be a single session treatment would cost something like $4,500 US dollars. This is something, the same treatment in Europe would be something like 12,000 US dollars, or in US it will be around 25,000 US dollars. The same treatment what we are speaking. Coming back to the second question, what is the cost we are charging for the trainees? I'm sure education is a free initiative. We want to share our experience, expertise, and want to disseminate the knowledge which we have garnered over the last few decades for the broader benefit of the mankind. And this is a purely non-commercial engagement, if I'm not mistaken.
Anybody else?
About the training, what is the duration or?
That's what I told you. It's a 2.5 day program, which encompasses didactic lectures, theory, practical nuances, everything.
And giving training to use this equipment?
Equipment and the science of radiosurgery, it will be both of them. Equipment is one part of the story, but how to choose the patients for this equipment is the most important factor which determines the outcomes. So choosing the battles is very important.
I think one aspect which people need to understand, that when you take the broader term of radiosurgery, this is one of the radiosurgical tools which is available, and we are very proud of the CyberKnife because it's able to perform certain procedures which other systems may find it a bit cumbersome. So it's limited technology available today. I'm sure, if you look at the last 15-16 years, it's taken 15-16 years for just about 10 or 11 CyberKnives to be installed in our own country. But even other regular linear accelerators can perform some of these procedures, but not to the level of accuracy or precision which the CyberKnife affords.
So you said for a session $4,500.
Yeah, per session. It's usually done, for the brain, it is usually done in a single session. Outside brain, it will be something like 3 or 5 sessions, depends on where we are actually doing. So that will be something like 6,000
Per session.
No, entire treatment.
There's nothing else. Yeah. Is there any other?
என் பெயர் டாக்டர் ரத்னாதேவி. நான் சீனியர் கன்சல்டன்ட் ரேடியேஷன் ஆங்காலஜி அப்போலோ கேன்சர் சென்டர் தென்னம்பேட். நாங்கள் 20 வருஷமாக வேலையாற்றி கொண்டு இருக்கிறேன். இன்றைக்கி நடந்த ப்ரோக்ராம் வந்து CyberKnife S7 FIM அப்படிங்கிற ரேடியோ சர்ஜரி எக்யூப்மெண்ட் பற்றி தான் இன்றைக்கி வந்து இன்றைக்கான ப்ரோக்ராம் நடந்தது. இது வந்து கொலாபரேஷன் வித் அக்குரே ட்ரைனிங்கும் இதை பற்றி அதை தான் இன்றைக்கி வந்து அந்த ப்ரோக்ராம் கூட மெயின் ஹைலைட்டு. இந்த சைபர் நைஃப் ரேடியோ சர்ஜரி வந்து ரியலி அட்வான்ஸ்டு டெக்னாலஜி. இப்போ வந்து 3 துறைகள் இருக்குது. கேன்சர் ட்ரீட்மெண்ட் அப்படின்னு எடுத்திங்கன்னா 3 துறைகள் இருக்குது. சர்ஜிக்கல் ஆங்காலஜி, மெடிக்கல் ஆங்காலஜி, ரேடியேஷன் ஆங்காலஜி. இந்த ரேடியேஷன் ஆங்காலஜியோட அட்வான்ஸ்டு, ரொம்ப பெரிய அட்வான்ஸ்டு டெக்னாலஜி இந்த ரேடியோ சர்ஜரி. ரேடியோ சர்ஜரின்னு நான் சொல்கிறேனே தவிர இதில் ரியல் சர்ஜரி கிடையாது. இது வந்து அவுட் பேஷண்ட் ட்ரீட்மெண்ட்டு தான். இதில் ரத்தம் கிடையாது, அனஸ்தீசியா கிடையாது, அட்மிஷன் கிடையாது. ஒரு அவுட் பேஷண்ட் ட்ரீட்மெண்ட். வந்து ஒரு எக்ஸ்ரே எடுத்துகிட்டு எப்படி போகிறீங்களோ அந்த மாதிரி ட்ரீட்மெண்ட் எடுத்துக்கிட்டு பேஷண்ட் போயிடலாம். இதில் வலிகளும் கிடையாது, எந்த விதமான பெரிய சைடு எஃபெக்ட்ஸும் இதில் கிடையாது. இது உச்சந்தலையிலேருந்து உள்ளங்கால் வரை எந்த இடத்துல டியூமர் இருந்தாலும் இதை வந்து நம்ம ட்ரீட்மெண்ட் பண்ண முடியும். இந்த எக்யூப்மெண்ட் இருக்கிறதுனாலே எல்லா கேன்சருக்கும் இது உபயோகப்படுமா அப்படின்னு கேட்டால் கிடையாது. பேஷண்ட் செலெக்ஷன் க்ரைட்டீரியா ரொம்ப ரொம்ப இம்பார்ட்டன்ட். எங்கே தேவையோ அங்கே தான் இது பண்ண முடியும். இது வந்து 2 வகையான, அதாவது கேன்சரும் இருக்குது, நான் கேன்சர் கட்டிகளும் இருக்குது. இப்போ பிரெயின்குள்ளார வரக்கூடிய சில நான் கேன்சர் கட்டிகள், மினிஞ்சியோமா, அகாஸ்டிக் ஷ்வானோமா, ஏவிஎம் போன்ற இந்த மாதிரி கட்டிகளுக்கு ரியலாக தலையை ஓப்பன் பண்ணி ஆப்ரேட் பண்ண வேண்டிய அவசியம் கிடையாது. இது வந்து ரியல் ஆல்டர்னேட்டாக இருக்கும். அதே மாதிரி அகாஸ்டிக் ஷ்வானோமா வந்து இந்த சிறுமுலைக்கும் பிரெயின் ஸ்டெம்முக்கும், அந்த முதுகு தண்டா உங்களுக்கு வரும் இல்லைங்களா, அதுக்கு இடையில் இந்த டியூமர் வரும். இது வந்து 7th நர்வ், அதாவது காது கேட்கக்கூடிய அந்த நர்வில் இருந்து வரக்கூடிய, அகாஸ்டிக் நர்வில் இருந்து வரக்கூடியதுனால இதுக்கு வந்து ஆப்ரேஷன் பண்ணும்போது அந்த நர்வையும் சேர்த்து தான் கட் பண்ண வேண்டியதாக இருக்கும். இப்போ இந்த ரேடியோ சர்ஜரி மூலயமா காது கேட்குற தன்மையை ரீட்டைன் பண்ணியே நம்ம இந்த டியூமரையும் ட்ரீட் பண்ண முடியும். மேற்கொண்டு வளர விடாமல் ட்ரீட்மெண்ட் பண்ண முடியும். அதே மாதிரி மூவிங் ஆர்கன்ஸ், நான் என்னுடைய டாக்கில் கூட நான் அதை மெயினாக நான் சொல்லியிருந்தேன். இது வந்து இந்த சிஸ்டமில் வந்து என்ன பெரிய ஸ்பெஷாலிட்டி அப்படின்னு பார்த்தீங்கன்னா, இதுக்கு வந்து ரியல் டைம் இமேஜிங், கண் இருக்குது. இது வந்து அந்த மூவிங் டியூமரை கூட அழகாக பார்க்க முடியும். அண்ட் ரொபோட்டிக் இருக்கிறதுனால அந்த டியூமரும் இதுவும் மூவ் பண்ணக்கூடியது. டியூமர் இப்படி மூவ் பண்ணும்போது இதுவும் மூவ் பண்ணும். ஸோ அதை சரௌண்டிங், அதை சுற்றி இருக்க நல்ல தசைகளை இது டெஃபினட்டாக கதிர்வீச்சு மூலம் பாதிக்காது. இது கரெக்டாக ப்ரிசைஸாக எந்த இடத்துல இருக்கோ அந்த மாதிரி, ஒரு மிசைல் எப்படி ஒரு டார்கெட் அடிக்குமோ அந்த மாதிரியான ப்ரிசிஷனோட இது ட்ரீட் பண்ணக்கூடியது தான் இந்த மெஷினரியோட ஒரு பெரிய ஸ்பெஷாலிட்டி. முன்ன காலத்தில் எதெல்லாம் நம்ம பண்ண முடியாதுன்னு நினச்சோமோ இப்போ அதெல்லாமே நாங்கள் பண்ணிட்டு பிரெஸ்ட் கேன்சர். ஆமாம்,
அது எப்படி மேடம்? அதுக்கு
பிரெஸ்ட் கேன்சருக்கு அதாவது அது லார்ஜ் ஏரியா ட்ரீட் பண்ணணும். அதுக்கு இந்த மெஷினரி தேவைப்படாது. எங்கே தேவைப்படுமோ அங்கே தான் இதை யூஸ் பண்ணணும். இதே பிரெஸ்ட் கேன்சரில் சில கேன்சர் பரவும். பிரெஸ்ட் கேன்சர் அந்த பிரெஸ்ட்லேயே இல்லாமல் பிரெயினுக்கு போகலாம், இல்லை போனுக்கு போகலாம், லிவருக்கு போகலாம். அங்கே இந்த எக்யூப்மெண்ட் யூஸ் ஆகும். இதுக்கு வந்து நாங்கள் மெட்டஸ்டேட்டிக் டிசீஸ் அப்படின்னு சொல்லுவோம். 1 2 2 டெபாசிட் தான் இருக்குதுன்னு வச்சுக்கோங்க. அந்த பேஷண்ட்டுக்கு நம்ம அட்டெம்ப்ட் கியூர் ட்ரீட் பண்ணும்போது இந்த இன்ஸ்டெட் ஆஃப் சர்ஜரி இதை யூஸ் பண்ணுவோம். இந்த பிரெஸ்ட் கேன்சர் பேஷண்ட்டுக்கு பரவீன கேன்சருக்கு, அதாவது பிரெயின்லேயோ இல்லை லிவர்லேயோ 1 2 மெட்டாஸ்டேசஸ், அதுக்கு பேர் ஆலிகோ மெட்டாஸ்டேசஸ் அப்படின்ட்டு சொல்லுவோம். அந்த மாதிரி ஏரியாவில் நம்ம ஓப்பன் சர்ஜரியை விட இது கூட நம்ம யூஸ் பண்ணக்கூடிய ஒரு நல்ல ஆல்டர்னேட்டிவ் டெக்னாலஜியாக அது இருக்கும்.
குழந்தைங்கள்லாம் வருது பார்த்தீங்களா, அவங்களுக்கு இந்த மாதிரி ட்ரீட்மெண்ட்
ஏவிஎம் அப்படிங்கிற ஒரு கண்டிஷன் இருக்குங்க ஐயா. குழந்தைங்களுக்கு வந்து இந்த ஆர்ட்ரியும் வெயினும் தவறான கனெக்ஷனில் இருக்கும். ஆர்டீரியோ வீனஸ் மால்ஃபர்மேஷன் அப்படின்ட்டு சொல்லுவோம். இப்போ ஆர்ட்ரி வந்து குட் பிளட் எடுத்துகிட்டு போகும், வெயின் வந்து பேட் பிளட்டை, இம்பியூர் பிளட்டை எடுத்துகிட்டு போகும். அது இயற்கையிலேயே அந்த குழந்தைங்களுக்கு ஒரு குழந்தைங்களுக்கு ஒரு டிஃபெக்டாக மாதிரி ஆர்ட்ரிக்கும் வெயினுக்கும் ஒரு கனெக்ஷனோட பிறந்திருக்கும். இந்த கனெக்ஷனுக்கு இந்த சைபர் நைஃப் ரொம்ப நல்லா யூஸ் ஆகும். இவங்களுக்கு இது ஆப்ரேட் மூலியம் தான் பண்ணணும்னு அவசியம் கிடையாது. இதுக்கு பேர் நைடஸ். இது ரெண்டும் கனெக்ஷன் ஆகிற இடத்துக்கு பேர் நைடஸ் அப்படின்னு சொல்லுவோம். இங்கே இதை ஃபோக்கஸ்டாக இந்த சைபர் நைஃபை நம்ம பண்ணுறதன் மூலயமா இது ஒரு வால் மாதிரி க்ரியேட் பண்ணி ஆர்டீரியோ வெயினையும் நம்ம செப்பரேட் பண்ண முடியும். இதுக்கு வந்து டைம் விண்டோ பீரியட்னு இருக்குது. அதாவது நான் இன்றைக்கி ட்ரீட் பண்ணுறேன்னா we have to wait for a period of 6 to 8 months time for this. அதாவது இந்த வால் உருவாக்குறதுக்கு நடக்கும். ஸோ இது வந்து ரியல் அட்வான்டேஜ் ஃபார் த பீடியாட்ரிக் கேசஸ். வலியே இருக்காது, ஈஸியாக குழந்தைங்க கூட அழகாக அண்டர்கவுண்ட் பண்ணக்கூடியது தான். இது வந்து ஒரு சிங்கிள் சிட்டிங்லேயே இதை ட்ரீட்மெண்ட் பண்ண முடியும். என்னுடைய பெயர் டாக்டர் ரத்னாதேவி. நான் சீனியர் கன்சல்டன்ட் ரேடியேஷன் ஆங்காலஜி. நான் இந்த துறையில் 25 வருஷமாக அப்போலோவில் இருக்கேன்.
தேங்க்யூ.